You want answers?
I'm as mad as hell, and I'm not going to take this anymore.
You want answers?
You have offended my family.
I think I'm entitled. You want answers? I want the truth.
And you have offended the Shaolin Temple.
You can't handle the truth.
Surely you can't be serious.
I am serious. And don't call me Shirley.
Radical Rant.
Once again, my one non-pot-smoking friend, the Joker to my Batman, Kevin Sabet, is out there, and today, actually it was yesterday, he posted an op-ed at the Christian Science Monitor that was entitled 7 Big Myths About Marijuana. I've listed them up here on the screen if you'd like to follow along. We'll just debunk them one by one because they're basically the foundations of his new book, Reefer, Sanity. And, of course, in Orwellian doublespeak, it's the most insane stuff about marijuana you'll ever read. We will give you a full book review as soon as we get our copy. But here we go. Here are some of the 7 big myths about marijuana, according to Kevin Sabet. And let's see here. Number 1. Marijuana is harmless and non-addictive. Well, this is what we call a straw man argument, because nobody out here is saying that marijuana is harmless and non-addictive. Now, is it less harmful than alcohol and tobacco? Absolutely. Is it less harmful than the prescription drugs that people are taking daily? Absolutely. Is it less harmful than, say, even aspirin? Yes, it is. And as far as addictive, far less addictive than tobacco, alcohol, cocaine, heroin, methamphetamine, about as addictive as caffeine. So nobody is saying it's harmless and non-addictive. Nice job fighting the straw man. Now, in fighting the straw man here, he does say, admittedly, marijuana is not as dangerous as cocaine or heroin, but to say it's harmless or non-addictive is to deny science. Again, none of us are saying it's harmless and non-addictive. He goes out with the 1 out of 6 adolescents who try the drug will develop an addiction. That's a stat we've debunked many times. Basically, they added together the percentages from a number of the age groups between 12 and 17 to come up with that number. Been very debunked. But here's an easy debunk of the 1 of 6 thing. Think about how many kids there are. And there's how many million of them or so that try pot every year. And if 1 out of 6 of them became addicted, then wouldn't they continue to be smoking as they get older? And yet we find the rates of marijuana smoking drop year after year after year after about age 18. So terribly addictive. Also, Kevin likes to say today's marijuana is some 5 to 6 times what it was in the 1960s and 70s. 5 to 6 times more potent than the 60s and 70s. Which is half BS because there wasn't a way of testing marijuana potency in the 1960s. But in the 1970s, the marijuana that was tested was marijuana that was left in hot, dry lockers for a long period of time, months and months, and so it had actually degraded. So they were starting with a baseline that was far lower than what the marijuana would have been if they'd actually got it when it was fresh. And again, 5 to 6 times more potent really doesn't matter when Marinol is 100% potent, and they seem to think that one's okay. They also like to say, he also says there's 400,000 emergency room visits in 2008 due to things like acute psychotic episodes and car crashes. Those might be a couple of things, but most of the things in those emergency room visit data are people who show up in an emergency room for whatever reason, and then when the doctors find out they've got marijuana in their system, ooh, that's a marijuana emergency room visit. Like, if you go skiing and break your leg and go to the emergency room, and you smoked a joint a couple of days ago, and they find the pot metabolites in your system, you're there for a marijuana-related emergency room visit. Ooh. He also goes on here to talk about marijuana's connection with schizophrenia, doubling risk of car crashes, reducing IQ by 8 points. We've debunked these so many times. I'm just going to move on because there's many more myths to get to. Myth number 2. Smoked or eaten marijuana is not medicine. Well, I guess it depends on how you define medicine. If you define medicine as a substance that has been evaluated by the FDA and deemed a legal medication in the United States, like Vioxx and Fen-Phen, yeah, then it's not a medicine. But if, like most sane, common sense people, you define medicine as something you take that makes you better, then by God, smoked and eaten marijuana is certainly medicine. He tries again to say this patient shouldn't smoke opium or inject heroin to get morphine. But the reason that you can say that is because morphine exists. With cannabis, it is better in its raw form than the other forms that are made from it. Patients report much better results with cannabis than they do Marinol, the morphine of marijuana. And Kevin tries to always come off as being compassionate, saying it's not to deny patients a medication that can help them, but to prevent smoked or eaten marijuana from becoming a smokescreen for recreational use. Got it, cancer patient? We can't let you smoke a doobie because some recreational smoker might smoke a doobie. You need to suffer so that we can try to stop the people from using it recreationally, which of course we've never succeeded at. His third myth from Kevin Sabet here. Countless people are behind bars for simply smoking marijuana. Actually, it says simply for smoking marijuana. And this is his, again, his reasoning that 0.3% of state prison inmates are there for smoking marijuana. 0.3%. Well, gee, considering there's 1.5 million state inmates, what does that work out to? 4,000 some odd people in jail simply for smoking marijuana? It ain't nobody. But furthermore, he ignores all the people that get there for a probation violation because they had a firearm in the house, and that's a gun violation, because they had kids in the house, and they get taken away for child endangerment, because of all sorts of things. If they were conspiring with someone, if they were growing a plant, if they were processing a plant, if they had their possession of marijuana in separate baggies so that they're deemed to be possession with intent to distribute. Those are all sorts of reasons people end up in prison or in jail for marijuana that don't end up in that state prison statistic he so likes to cite. And furthermore, he goes on to say most people arrested for marijuana use are cited with a ticket. Very few serve time behind bars. Well, that's just an out-and-out lie. Decriminalization only exists in, 15 states in the United States? So many are changing. I don't know if I've got the exact right number yet. In the rest of those states, 35 of them, it's an arrest. It's a misdemeanor at least. In Florida, it's a felony for 3/4 of an ounce. Number 4 myth from Kevin Sabet. The legality of alcohol and tobacco strengthened the case for legal marijuana. Well, I don't ever recall saying it that way. I recall saying that the failed prohibition of alcohol and the successful regulation of tobacco make for good arguments for legal use of marijuana. We've gotten tobacco use down among 12th graders in this country from 70% lifetime use when I was in high school to 40% lifetime use today. And tobacco is available to kids age 18 or 19 in this country, completely legal, marketed by Big Tobacco, and yet we reduced it 30 percentage points. Why wouldn't that be a good way to deal with marijuana, especially since more kids are smoking marijuana now than smoking cigarettes? And I love this point of Kevin Sabet's. Alcohol happens to be legal for cultural reasons. Oh, so you're admitting that our drug policy isn't really based on the science or how much harm it may cause or how much tax revenue we may generate. It's really just a culture thing. It's a litmus test. It's a cultural litmus test. Alcohol's popular, so we can have it. Marijuana is used by stoners, so we can't. Well, here's a little note about marijuana culture. We have had hemp culture in this country since 1611. We have had medical marijuana culture in this country since 1840. We've had recreational marijuana in this culture, at least among the minorities, since 1900. And we've had popular mainstream white folk culture of marijuana since the 1960s. Just give us a number. How many years or how many people have to use it before it's culturally okay not to lock them up for simple possession? The number 5 myth: legal marijuana will solve government budget problems. Again, a straw man. Nobody said legalizing marijuana will solve all the budget problems. What we are saying is that right now, people are smoking marijuana. It might cost our society something, but we are currently bringing in zero in taxes, and we're spending billions in a futile attempt to try to stop it. He comes up again with this Sabet conjecture that legalization will cost America, for every $1 in state and federal revenue from alcohol taxes, America spends more than 10 in social costs. Well, again, alcohol and tobacco are toxic and addictive. They're going to cost more in social costs. They're toxic and addictive. And furthermore, alcohol leads people to be dumbasses and do violent things. That's going to cost society more as well. We've always pointed out that Canadian study that found the social cost of one tobacco smoker was $800 to Canada. The social cost of one drinker was $300 to Canada. And the social cost of one cannabis smoker, $20. You think we can collect $20 worth of taxes on a pot smoker in a year? Number 6 myth. Portugal and the Netherlands provide successful models of legalization. Well, yes, they do. Except it's not really legalization, it's decriminalization, which Kevin Sabet likes to point out. But he tries to say that in Portugal there's some, confusion or there's some argument about whether it's been successful. I look shit up. So I went to the EMCDDA, which is the basically it's the National Survey on Drug Use and Health, Europe's version of this. And I looked up the data sheets for Portugal and found that drug use in Portugal, this is cannabis use, in Portugal in 2011 was 16%. Among young adults, it was 6.7%. Among all adults, it was 3.6%. Okay, so 16, 6.7, and 3.6. What were the numbers for other countries in Europe? Well, gosh, in the United Kingdom, 25% of school kids, 12.3% of young adults, 6.9% of all adults, about double the prevalence among young adults and all adults, and a much greater prevalence among the kids. How about France? 39% in schools, 17.5% of young adults, 8.4% of all adults. How about Germany? 19% in schools, 11% for young adults, 4.8% for all adults. And Spain, right next door to Portugal, 19% for all schools, 11.1% for young adults, 4.8% for all adults. In all those countries, 9.6% for all adults, 17% for young adults. And we don't have a number for the schools for Spain. Regardless, right next door to Portugal, and all throughout the European Union in the largest economies, much greater use of marijuana than they've got in Portugal. And finally, number 7, people have always smoked marijuana and always will. Why try to stop it? This is where he tries to say that only 8% of the people smoke pot, that 52% drink, and 27% use tobacco. Because they're addictive! You always leave that part out. More people use them because they are addictive, not just because they're legal. And if more people smoke pot, it's a good thing.
This is the Russ Belville Show. The Russ Belville Show is blogging and podcasting daily at RadicalRuss.com. When
more people smoke pot, less of them binge drink, less of them drunk drive, less of them beat their wives, less of them overdose on prescriptions. I'm Radical Russ. That's all the time we got. Thanks for joining us. Until next time, take care of each other, tokers.